Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. It's been estimated that 1 in 5 U.S. adults suffers from chronic pain. Many pain management doctors prescribe spinal cord stimulators that block pain signals to the brain to treat chronic pain. But now, the first artificial intelligence-based spinal cord stimulator is available and it helps patients take control of their own pain treatment. It's called HFX IQ and it has been described as a real game changer in chronic pain management. So today, we're talking with a doctor who's treating his patients with this AI-based spinal cord stimulator, Dr. Richard Vaglienti, Director of the WVU Medicine Center for Integrative Pain Management. Welcome, Dr. Vaglienti, to Tuesday Talks.
Thank you. Good to be back.
Good to have you. If you have a pain management question for Dr. Vaglienti, just post it in the comments section below and we'll try to answer it live. Okay, so you've been on this show before. We've been talking about spinal cord stimulators, and the last time we were talking about HFX for painful diabetic neuropathy, or PDN. But this is HFX IQ that uses artificial intelligence. So tell us exactly how this works.
Well, this is the only device that uses artificial intelligence to change programming for patients. So we're using it now. We've implanted several of these. We've implanted multiple systems for diabetic neuropathy and a few with HFX IQ. So what happens is you have an interface with your iPhone.
Okay, we've got props. Here we go.
That looks a little bit like this. This is what the opening screen would look like. You put in some information, you know, your name, age, and other things, and then your phone then links via Bluetooth to the battery that's implanted under the skin.
Is that what this is?
That's what this is, the battery. And so the phone talks to the battery. And what happens is every day you dial in or you open up your app and you contact your battery and you tell them what your pain score is, how much pain relief you have, and what your activity level is. And you do that every day. The more data you enter, the better response you're going to get from the equipment. And so initially when this starts stimulating, it stimulates for a few seconds on and a minute or so off. That's called cycling. And it cycles because that saves the battery. But if you were to report 2 days of 10% pain relief or less, the first thing this machine does is it will stop cycling and it will put you on constant stimulation, and then it will wait until you put in more information to know whether it was successful or not. The same thing will happen if you give a report of 30% or less pain relief for 3 days. It will then start to do the same thing. And over time, it will know which particular electrodes and what settings that you have used that have given you the most pain relief based upon your input. And then it will start to suggest for you various programs to try that you can then select for your equipment to use. And again, then the cycle starts over again, reevaluating your relief, proposing new programs, and then reevaluating that relief again. So before this, you would have to call your physician's office, or you'd have to call the company representative. You'd have to arrange to meet with them, and they would have to try multiple programs. Now that eliminates that step. So you can do this from home, and you'll have better relief faster. If you need to come in, certainly we welcome you to come in and get some personal contact. But this is the big difference, is it eliminates interaction with a representative.
And I know it's artificial intelligence, but you're teaching, the device what works best based on your input. So this is just part of your regular routine. You know, you start your day, you open the app and say, hey, this is working, this isn't working.
Right.
And it prompts you, it asks you specific questions?
It does, and I just did it here before we went on the air, and it started to ask me, what activities I really would like to perform that I can't. For example, exercising, gardening, playing golf for sports, playing with the grandchildren. And then it will start to guide you as you report back, whether those have improved or not. And then it will make suggestions to try to get you toward the goals that you have set for yourself.
So it really puts the patient in the driver's seat, doesn't it?
Yes. Unlike any other spinal cord stimulator system I've ever seen, I've been doing this a good bit.
Well, yeah, you've been treating your patients with this particular spinal cord stimulator for a few months. What kind of results are your patients having?
Well, you don't want to use the word miracle, but if it were a miracle, this would be pretty close.
Wow.
So patients who, first of all, their pain gets improved significantly. Our results have been more than 75% pain relief and oftentimes more than 80%. Return of feeling to the feet. One of our great success stories was this lovely lady who hadn't driven her car in 2 years because she was afraid that she couldn't feel the pedals.
Oh my
And
gosh.
so during the 1 week trial, she was able to go to Walmart and go shopping, and she didn't want to give up the trial stimulator. She just wanted to keep it and keep going. So it's
wow.
Stories have been in line with that.
Yeah. So, you mentioned the trial. Can you tell us exactly what that is? I mean, this is an implant, right? So
Right.
this is implanted in the spine?
Right, in the hip.
In the
right.
hip.
Under
in the
the
hip.
skin, right.
Under the skin, okay.
Yep. The wire goes in the spinal canal over the spinal cord, okay? And then we do a trial of stimulation for 1 week, 7 calendar days, and then you report back whether it worked or not and whether you liked it or not. In the meantime, you're in contact with the company representative who's giving you new programs, and that particular individual is functioning in the same function as this will do for you once it's fully implanted.
Wow.
So he takes your data, your information, whether you have good relief or not, he reprograms as much as is needed, and then you try a next setting and see if you get relief. And he gives you multiple options that you can choose on your own. But not nearly as many as this piece of equipment will do. It'll give you, I believe, 5 different programs with 7 different options for each program, so 35 possibilities.
Wow. And it's a non-drug solution, right?
Absolutely.
Wow. And by trying it out for a week, it's not permanently implanted, it's like temporarily just attached to,
Yes.
Okay.
Yeah.
And then if that works fine for you?
Yep.
Okay, so say after the trial works really well for me, and then I have it implanted. I mean, do you have to go back in every so often to change or charge the battery, or how does that work?
That's a great question. So this particular system now is rechargeable. So you have a device that goes over the battery through the skin, and it will recharge your battery usually once a week, rarely more than that, and sometimes longer than that. And so then this...
So you hold it over,
Right.
and it charges through your skin.
Correct.
That's really...
Correct. And the
Wow.
charger is chargeable so that you can walk around with the charger. You're not married to being plugged into the wall. And then about every 9 or 10 years or so, the battery depletes and has to be changed. But that's a very quick outpatient procedure to have that done.
Well, that sounds like similar to, not a defibrillator, but
Pacemaker.
Pacemaker, thank you.
A lot of people call this pacemaker for pain.
Yeah, and that's what it's turning out to be, it sounds like. So what kinds of chronic pain does this HFX IQ control?
Well, spinal cord stimulators in general control pain, usually used to be from failed back surgery syndrome. So if you had back surgery, 1 or more back surgeries, and you had persistent pain after that, that was the main use of spinal cord stimulation. But as you can see from what we're here talking about today, the indications continue to expand over time to the point where this company was the leader again, and that's kind of why I like to be associated with them, because they're on the forefront. And our clinic tries to be on the forefront, so we have the same mindset. But they have gotten approval from the FDA for non-operative back pain. So if you have chronic back pain that surgery is not an option for you, or you decide not to have surgery, then spinal cord stimulator for chronic low back pain is now approved. However, insurance companies are lagging behind. And so they're catching up now with peripheral diabetic neuropathy, but there are so many patients with chronic back pain that it'll take a while before it's decided that that's a cost-effective way to treat back pain.
So do most insurance companies cover this right now?
For peripheral diabetic neuropathy, they're starting to get on the bandwagon. And in speaking to some other physicians and in speaking to the chief medical officer of this company, we think, and I agree with them, that this may show benefits that we don't know yet. For example, we know spinal cord stimulation improves circulation. And so we know that diabetes doesn't improve circulation. In fact, it hampers circulation. Yeah. And so it's possible, and I think it's highly likely, that circulation will improve in the lower legs and feet, and this may lead to prevention of diabetic foot ulcers, which is a catastrophe.
Oh my gosh, so many different uses and so many different things, and these aren't small changes that are being made in people's lives.
Right, and all that's being studied now and looked at. As more and more of these are implanted, the company's collecting more and more data, and so after a period of a few years, we'll know, for example, if the general rate of peripheral diabetic ulcers is something, and what we see is less than that number, then we know we're on the right track.
Okay, so what would you say are the overall benefits of using HFX IQ?
It restores you to a more normal life, and so that's what we're always looking for. We're looking for maximum level of function at the lowest possible level of discomfort, and the results have been fantastic. I've been practicing a long time, and there's only been one or two other things that I would qualify or classify as being as game-changing, to use your words, as this equipment.
Wow. Okay, so those are the benefits. What about the risks? What are the risks for using this system?
Well, the risks are the same as for any surgery, so bleeding and infection and injury to nerves and those kind of things. In the diabetic population, we know in general when you have surgery you have a higher risk of non-healing, of infection, of those kind of things. So we're very wary about that. Overall, when this was first studied, the complication rate was about 3%. And that doesn't sound like much, but in the non-diabetic population, the complication rate is about 1%.
Oh, wow.
So 3 times as high, but still not very high. And we're very careful. We've come up with various processes to try to minimize that. And I think one of the things that's different about us from all other clinics that might do this is we have a program for this. So if you come in and your diabetes is wildly out of control, we have contact with our endocrinologists. We have counselors in our clinic who can talk to you about depression or anxiety. If you need strengthening, we have that available. And so that's what's different. This is not just somewhere where you, like an assembly line, roll through, get a stimulator, and roll out the other end. If you need alternative care or additional care, we have that, and we've arranged for that. And I think that's one of the things I'm most proud of.
Oh, that's great. That's great. So who would you say then is a good candidate for this device? I mean, is it for everybody?
No, there are going to be some people who either medically or for some other reason aren't good candidates. But in general terms, if you have peripheral diabetic neuropathy and you're relatively well controlled, you're a candidate if there aren't any things that preclude you. One of the things that's required by all insurances is that you have a psychological evaluation, because we know if you have uncontrolled anxiety or depression, you're not going to do well. But basically, if you have diabetic neuropathy and you've failed 2 or more medical therapies, you're a candidate.
Oh, okay. And so if someone's interested in this kind of treatment, where do they start?
Well, they really should just contact us, and specifically, if you call the clinic, we'll put you in contact with one of our case managers who control this program and get you in for evaluation as quickly as possible. And then we only have certain practitioners who are in this program, and then you're slotted to see them, and then the process starts. You're given information about the procedure, you get scheduled for your behavioral medicine evaluation, and then we get insurance authorization, and then you're set up for your trial, and then that's the beginning.
Wow. How long does all that take?
It depends. So, you know, we can cycle somebody through in 4 to 6 weeks if it's perfect, but more likely it's going to be 8 to 12 weeks by the time everyone gets on board and we get your authorizations, and then we have to get surgery time, and so those are the limiting steps. Once the trial's complete, insurance and surgical scheduling become the limiting steps.
Okay. So you've been offering this at the WVU Center for Integrative Pain Management for a while. Why should patients come to the WVU Medicine Center for Integrative Pain Management as opposed to going somewhere else? I mean, are they going to find these kind of treatments somewhere else? Why should they come here?
Certainly you can find these treatments other places, but you won't find them under one roof like you will at our place. In addition to that, being part of the WVU health system, we have access to very high-level specialists in all areas. So as I said before, if you have diabetes that's poorly controlled, we send you to endocrinology. If you have other problems, we can send you to other specialists. If you happen to have open wounds, we send you to wound care. And the very good part of that, besides getting tertiary care close to home, is that all your medical records reside in one place.
That's right.
So when you come into my clinic, I know who you saw and I know what they recommended, and I can fold that into your treatment plan without ever getting up from my chair.
And you have a whole team of experts at different levels at your disposal.
We do, and I think that's the difference. Other people, you'd have to be sent to physical therapy, you'd have to go somewhere for this and go somewhere for that, and we have a lot of that in one place.
Excellent. Okay, so what's the most important thing you want people to know about HFX IQ?
Well, that it's highly effective for diabetic neuropathy, and it can be life-changing. That's some of the reports we get back from patients we've already implanted.
I'll bet.
And there really isn't any need for you to suffer. The treatments that are available for diabetic neuropathy now, the medication and other things, are not very effective. And in fact, it frustrates primary care physicians because they're very difficult to treat.
Yeah.
And so this has interposed itself into that equation and may ultimately over time be the primary treatment, the first thing you do rather than the last thing you do.
Wow, so you just don't have to live with the pain.
No, you don't. At least let us look at you and give you an opinion.
Yeah, okay. Well, thank you so much for sharing. I mean, this is really exciting stuff.
I agree.
And you said it's growing. I mean, it's really taking off, isn't it?
It is, absolutely.
Well, thank you for sharing this information, and I think you may be helping a lot more people today.
Well, we'll try.
Yeah, yeah. Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information on pain management, you can always visit wvumedicine.org/pain. And join us on Tuesday Talks on July 18th when we'll talk about social media and mental health with Dr. Jonathan Pearl, a clinical psychologist with the WVU Rockefeller Neuroscience Institute. I'm Mary Ravazio Menard, and on behalf of Dr. Vaglienti and everyone at WVU Medicine, thanks for joining us and have a great day.